Before the weekend, I wanted to come back on the data that was presented to you this morning, especially to the journalists, based on the two studies by the INES, l'Institut National d'Excellence en Santé et Services Sociaux, as well as the one that is published by l'INES-PQ, l'Institut National de Santé Publique. Our efforts are paying off, but we must continue if we want the cases to decline. I think we have been doing well on stabilization, but we want those cases to continue to decline. For what? Why do we do this? It's because we want to protect our health system, and we want to have as few victims as possible. That's very clear. And I would say, here's in summary why we should not let go the effort that we do. L'Institut National d'Excellence, first hospital projection that have been published this morning have changed positively since last week. That's good news. Quebecers have made a great effort in recent weeks to limit their contacts. Good work. And therefore, they managed to change the trend in hospitalization. I think this is quite something. I mean, we have changed the trend. And I think this is important to notice and thank Quebecers. On the other side, the data that has been presented by INES today show that our hospital capacity could be adequate for the next few weeks, as everywhere in Quebec, even though, I'm being prudent, the situation is very fragile. And that's the reason we had to do some delisting, as you know, unfortunately. So, in summary, the good news is, and I repeat, our behavior must not change. We have been successful in the last few weeks, but we must change. And I think in the scenarios that have been demonstrated, I think if I say not only we would have hit a wall if we didn't do what we did October 1st as Quebecers. Second, we have made quite a difference. That confirmed the other study that I presented. But third, they've made clearly, those specialists, those people that we've used in those studies are very clear. If we decrease by one contact per person, one contact that is important, if we go from 5 to 4, as it's very clear in the study, that could make a huge difference over the next 4 weeks. So that's my summary for today, and thank you again for listening, because maybe I took a bit longer, but I thought it was important to give you the details of those two studies.